Up next on Health Unmasked.
Either way, Ebola can be sexually transmitted.
Even the discharged people, please take more 6 months without having the sex.
Hey,
Yes.
how do you even touch me if you were a case for Ebola and you recovered? Am I not even going through that?
Ngenda pull over.
Yeah, and you go eat it up.
With 6 months. Yes. Okay. Let us take the 6 months.
Yes.
Please report that person.
Imagine having a fever, a headache, a little weakness. Most people would think it's just malaria. But what if these signs and symptoms are just early warnings of a deadly virus that could spread through our family members, communities, and the whole country at large? A disease that is so deadly that even caring for a loved one could put your own life at risk. Today on Health Unmasked, we are going to dig deep into the facts about hemorrhagic fevers, specifically Ebola. We want to know how it comes about, how it spreads, why it is so deadly, and what all families should know in order to stay safe. Welcome to Health Unmasked. I'm your host, Charlie Padafin, and as usual, I'm not alone. I'm with my co-hosts, Alfat and Fred. And to understand this topic a bit more, we are honored to be joined by Dr. Ronald, who is a medical practitioner and a consultant on TikTok. Doctor, you are most welcome to Health Unmasked.
Thank you very much.
Are you ready to unmask the facts about Ebola that everyone is talking about right now?
Yes, of course.
So, we hear terms like hemorrhagic fevers, Ebola, and the moment someone hears about that, they get scared there and then. So, doctor, we would like to know, we would like to understand in a layman's language, because Ebola is something that everyone is talking about right now. What does it mean? What is Ebola? What are hemorrhagic fevers in specific?
Thank you very much, Dr. Daphne. I'm so privileged being here, actually. This marks my second podcast.
Oh, yeah. Thank
So,
you.
and I'm really so blessed being here to communicate with the world since we are really going through this pandemic.
Yeah.
I'm Ronald, as Dr. Ronald, as she has said.
Yeah.
I'm working in many places, and I'm on TikTok. Yes, I do consultations on TikTok. I respond to people.
Yeah.
I use Dr. Ronald KM. You can really tap in there.
The username is Dr. Ronald KM. In case you need to know anything more about what we've discussed today, you can consult on TikTok.
Yeah, thank you.
Yeah.
So in response to the question, what is Ebola? And what should people know about Ebola? Generally, Ebola, there's a Ebola virus and Ebola virus disease. Those two things are different.
Yeah.
So I think if you say Ebola virus causes the disease, so you get the virus, then you get the disease.
Yes.
So Ebola virus refers to a microorganism that causes, it's lethal, infectious, and causes symptoms that fall under hemorrhagic diseases, as we are going to see. So in that family, it's not only Ebola. We have heard of yellow fever, we have heard of Marburg. Yes, so we have heard of, there are very many hemorrhagic diseases that fall into that family.
Oh, yeah.
Yeah, so, and now to generalize, I'll break to hemorrhagic. What is an hemorrhagic fever?
Yeah.
As the term hemorrhagic, that's blood, right? So hemorrhagic, these diseases go into in simple terms, the pipes that transport your blood cardiovascular vessels, and they disorganize. You get it? And they affect how your blood clots. We all well know that if you get an accident, your body stops the bleeding by forming a clot, that black thing that people normally see. So what these diseases do, they affect and they prevent the body to do that. the results, you're going to bleed.
Yes.
So that's what the term hemorrhagic comes from. That these diseases make you bleed until death, if not managed.
Oh.
What kills you is hypovolemic shock. Little volumes in your body, simple terms.
The little volumes of blood.
Exactly. It can be blood. Of course, now blood is made up of very many components.
Yeah.
And of course, if you lose blood, now just take it that little volumes in your body. So that's what the public should know. And they really, it's very fatal.
Yeah.
Very fatal and really very dangerous. Because now you're going to bleed through the eyes, you're going to bleed through the nose, you'll have gum bleedings. And in some cases, even when you don't bleed, it doesn't remove the fact that you can bleed internally.
Yeah.
And still.
So even when we do not see the bleeding, you might be.
Exactly.
Okay.
Yeah, so as the further discussions are going to go on, I think you may find that we have not talked of bleeding. That doesn't mean that it's not Ebola or it's not an hemorrhagic case.
Yeah.
Thank you very much.
So, doctor, you've talked about the diseases of the kind of Ebola that fall into that family, and you've talked about yellow fever. So why is it that the most trending disease in that family is Ebola? Why is it that yellow fever is not putting people on panic? Because we are seeing the government trying to put up measures to see how we can manage Ebola. Why is it that yellow fever is not putting them on panic? People are not talking about it, yet we have it.
Thank you very much. First of all, Ebola, as we're going to go far, Ebola is a funny virus. But now this is a home virus within Africa.
Yeah.
Generally, Ebola actually came from Ebola River. That is in Congo. Meaning it came within here.
Yes.
And if you look at the episodes, we have so far had 8 episodes.
Of Ebola.
Since 2000, yes. And it's a bit new. We are still trying to study it.
Yes.
Yes, and since it's a virus, as we all well know that there are no typical cures of these viruses. They are very funny when it comes to getting the modes of curing them. So if something is new, it really keeps on reoccurring as we are trying to study it. Right now, the strain as of Uganda and Congo, it's Bundibugyo strain, which was recently discovered. Yes, right now, which was recently discovered in 2007, and in Uganda, Bundibugyo is in Uganda, Western Uganda. So meaning that we have a task. Yes. We have a task as the Ministry of Health. We have a task as the World Health Organizations.
Yeah.
So that we really combat, because now the occurrences now are becoming many. So with yellow fever and other hemorrhagic cases, of course, they all started the same way. And with time, of course, managements, preventions, then we happen to seize them, but that doesn't mean that they're not there.
Yeah.
That's why you can't travel to any country without a yellow fever card.
Yes,
Reason,
that is true.
Yes, reason being
required.
They are trying to prevent further spread.
Which means by this time, maybe in 2030, Ebola will also be weak like some other diseases that we have, not so alarming like today.
I won't strictly say that.
If we try to project.
Exactly. Maybe if we try to project, that is it, because, and you should take in the fact that different strains come in at different levels.
Oh.
One of the initial strains was Zaire strain. There's the vaccine.
Yeah, right now we have a vaccine.
The vaccine is there, and in case if it was the study was done, it was the Zaire strain, we would still be doing vaccination. Yes. But now we have other strains like Sudan strain, Bundibugyo strain. They are all still there, and we don't even have the vaccine yet.
So they are not seated. They are also trying
they are trying to wait for the port of entry.
Yeah.
Exactly.
So that is the funny part of them you've been talking about. So I want to bring to our notice, our dear viewers, the signs and symptoms of Ebola virus. You people, last time, I think it was on Tuesday, we had a case in the old tax park, Kampala. People called the Ebola rescue team because someone was feeling weak, someone was vomiting. They're like, is this not Ebola? They called the rescue team. On reaching on the ground, someone was just hungry. So you people, someone was just given food and all was well.
So people should live people should live home when they are satisfied.
Now, so you see that it is also of importance to sensitize the public
And the community.
about the typical signs and symptoms of Ebola virus. Yes, the rescue team is there, but we need this little information to make sure that we call the team where it is necessary. So, Fred, can you please share with the viewers some of the, in layman's language, because I know you have a lot of terminologies you would want to use, but we want to see in simple terms the signs and symptoms of Ebola virus.
Okay.
Yeah.
Thank you. Good evening.
Minus vomiting for anger.
Good evening, our lovely viewers. Thank you again, once again, to watch this session.
Yeah.
We are excited to fact check some of the scenarios we are seeing on social media. As you heard of that one, they saw someone vomiting, then everyone started thinking that the person is suffering from Ebola.
Yeah.
For starters, I would like to begin by saying that Ebola has something called incubation period. It's usually, this is a period where it's a bit, they call it dormant. It's not so
Hasn't
active. Yes,
manifested.
it's around 2 to 21 days.
Yeah.
So usually, the signs and symptoms are categorized into 3 different categories. Usually, the early signs occur during the incubation period, which is from 8 to 10 days. Within those days, within the other 21 days of the incubation period.
Yeah.
And one of the symptoms is fever. And usually this fever, it's not the usual fever we experience, like, let me say, the malaria fever. This fever usually tends to persist. The fever, usually it's around 38 degrees Celsius and above. Usually you get up to 40, up to 41.
Fred,
But usually it tends to persist, this fever.
like, to get this clearly, what exactly is fever to a person watching this? Because I may be hearing the word fever, but I
We
don't know
need
what
to
fever
make
is.
everything
Fever.
clear.
Usually when your body temperature is high,
Yeah.
maybe in a simpler way. Temperature, what is temperature? I
Well,
believe-
increase in body temperature, I think at least that is.
Alpha, you should put it for us in
But
Uganda.
I think that is at
What
least
is
okay.
temperature in
In Uganda, we also call it temperature. Temperature
Okocha.
iri
and usually tends to persist. It's a bit long.
Yeah.
Then also another sign is headache. So, you might be experiencing also headache that is persistent. We have always experienced headache. You might think, this is some normal headache.
Yes.
And you're ranked by action.
You don't
Panadol.
mind so much about it. But since we are in what they call public health crisis, you have to be extremely vigilant on signs like headache, we talked of fever, then there is a muscle pain and joint. Usually, usually maybe you do exercise for the first time, maybe you play football. Then you don't do it the next time, then you feel that pain. Usually there is also muscle pain. So when you see the confluence of headache, you're seeing there is fever, you're seeing there is muscle pain, you're seeing there is headache. You shouldn't get scared so much, but at least that should help you, should guide you, because
it should alarm a warning.
that is how Ebola symptoms manifest. Then usually after the early signs and symptoms, we go to the mild signs and symptoms usually, because they're in different degrees, the signs and symptoms. Usually we go to, now these ones are serious. Number 1 is vomiting. That is why we saw that scenario. I think it has been trending on social media.
Yes.
It scared away people. In actual sense, the individual wanted just to add some glucose in his body. So usually you vomit. As our a knowledgeable doctor told us that, you know, this hemorrhagic fever usually it involves the concept of blood.
Yes.
So someone might vomit fluids. It can be maybe a combination of maybe water and food you've taken, but also you can also vomit out blood. There's a possibility of someone vomiting out blood.
Yes.
There is diarrhea. Diarrhea is severe. You can also pass out blood also. So when you're experiencing these symptoms, you have to be extremely vigilant. And if you're a serious citizen, you need to report very fast to a nearby health facility.
Yes.
Then other scenarios, you find out that blood will start coming out from openings. Can be your ear, can be your eyes, can be any, maybe you had a cut on your skin. Blood can also start coming out of it. I saw something on social media at first. I thought maybe it was AI. You know, nowadays it's very hard to trust anything you see on social media.
That's true.
But actually, someone fact checked it and it was real. This was an incident. This was Ebola patient. Or the eyes, blood was coming out of the eyes, out
So
of the
is
nose.
is that blood coming out of the body openings indicating that there has been an internal bleeding?
Exactly. And I trust our consultant is going to explain, is going to go deep and tell us why does even the blood come out, where does it come from. I believe he's going to tell us more about that. But mainly now I want to sensitize people about the signs and symptoms. They should take it very serious. Other signs and symptoms you find, there is stomach ache.
Yes.
You really feel the pain. The stomach really pains also.
So
then from there
that means the other people we actually rate suspected because if someone was vomiting,
especially the timing, we are in the crisis where Ebola
and the guy was hungry.
Ebola is
the white stomach ache because when you're hungry,
Ebola,
you have abdominal cramps.
Ebola is the talk of the day. So
people will rage.
They had to suspect it.
Yes.
Then we go to usually this is now where it becomes, I call it fetal. This is where now you coming back, it is a bit hard. There is a point where you reach to experience also internal bleeding.
Yes.
You bleed internally, and that is usually very risky. Very risky, is not good.
Because we've said that this virus attacks the blood vessels, meaning that it's going to destroy the vessels inside you, causing the internal bleeding.
Then ultimately there is what they call organ damage, or then you will end up on what they call organ failure.
Yes.
So you know usually what happens if your heart fails, if your liver fails, definitely you're going to kick the basket.
Yes.
But let me put a disclaimer: is that Ebola is not a death sentence. We have been hearing people have been recovering. Like in Uganda, we had, I think, 15 cases confirmed.
Yes, and by the way,
and
we're
I
going
think
to
it's
get
only
the
one
statistics.
day. Yes, and so far two have been discharged. So when you get Ebola, it's not a death sentence. People are recovering from it.
Yes.
So precisely, those are some of the signs and symptoms. The public out there, you should take care of that. Look into that. You should be extremely vigilant towards those simple signs and symptoms I have summarized.
And by the way, it is very important now. That is when we say that these people were right to call the rescue team, because it would be worse if at all you see some signs of Ebola and maybe say, this one is hungry, and you do not call them, leave the person to stay with you, yet it is Ebola, which means at least you rather disturb them rather than leaving the person who has contracted Ebola in the community. At least you call the rescue team.
I wouldn't say that is disturbing, because I mean they are put in place to serve the public and response to Ebola.
So they should come tell you, whether it is or it is not.
Yes.
But
And
is
the
there any
crisis.
disease that manifests like that causes the bleeding out of the body
The body
opening?
openings.
Is there a disease we have so far that does that? Someone bleeding, the eyes bleeding, nose, ears. Do we have that disease?
Normally
if we
people,
see that-
normally people can have some other conditions like epistaxis, people can have hematemesis, but of course they're not that much serious like Ebola.
Yes, which means by the moment you see a combination of those signs and symptoms, of course it is Ebola. So I want to reserve Dr. Ronald for the myth and the facts and the questions from the comment section. Please keep sending in those questions such that by the time we leave here, we have addressed everything, almost everything about Ebola. So, Alfat, I want us to go through ways how we can prevent Ebola virus from spreading. Some of them have already been put in place because we have seen the SOPs coming back. So some of them are not yet. So I want to get all those preventive measures, some that we can do as ourselves, and how the government can help us to see that we combat this virus.
Okay, thank you very much. Now, I'm so much privileged to be here again. And before we talk about the preventative measures, first of all, how is this disease spread? Because we are not going to prevent
Yes.
it unless we know it is spread.
Yeah.
Unlike COVID-19, Ebola is not spread through air. Like you breathing air with the same person who is diseased doesn't cause the disease to you. You is not diseased. That is
Yes.
a fact.
So
But
it's not
usually,
airborne.
it is not airborne. But usually Ebola comes from you getting into contact with a diseased person's body fluids. Let's say this person has sweated, this person has passed out mucus, this person is bleeding, this person you having sexual intercourse with a person and then they secrete their semen into your body. So, by either way, Ebola can be sexually transmitted. It is
Look
a
into
fact.
the camera and emphasize
Yes,
that.
Ebola can be sexually transmitted. That is a
Yes.
fact. Because we are saying it is spread through body.
And by the way, Alfat, I think at that very same point, okay,
Yes.
as you conclude, you should even talk about the people at risk. Because we are in the same country, but you can see that there are those people that are at risk because we didn't even have,
I
we didn't
see.
go to Namugongo because of that.
I see where you're driving me. You're bringing the point that
I want
exactly
to see the
fits.
people at risk.
That is where you bring the point. But usually, you see, there are people who are unemployed but self-employed.
Okay.
There are people who are unemployed but self-employed. They don't have work to do, but themselves, they are what? They are work.
Okay.
Someone is a shop. You yourself, you're a shop. So, in quotes,
We are listening.
people who are selling meat, I mean, meat. So those people are at risk of contacting disease because you're going to get a client, you don't know where this client is coming from. Maybe a
Yes.
client who has traveled all the way from Modibujo to Kampala. And this client has his money. He came with a G-Wagon. And
Yes.
he's willing to pay 100 just for a few hours. So you're like, today, my God has answered my prayers. And then your prayers are being answered for you to go to hell.
Yes.
Because you're going to contact that disease. So at least those people should be vigilant and they should stay warned.
Yes.
Like I've said, it is spread through semen, mucus, blood, sweat,
Yeah.
all kinds of body fluids. They can make you contact that disease.
Okay.
So how would we prevent that disease? First of all, since we've known now it is spread, let us first of all stay away from let us avoid contact with body fluids. If you know someone is your partner, maybe a sexual partner, and you're seeing signs and symptoms of the disease, please, a day without food doesn't kill a person.
In fact, call the rescue team to take
Yes. So you can avoid the intercourse for that particular name.
You mean even kissing?
Definitely. Because you're exchanging body fluid. Saliva is a body fluid.
Yes.
So even kissing can cause the disease.
Yeah.
Exactly. So please, first of all, let us avoid sexual intercourse. Unless the person is what? You much 100% sure this person is not in contact with the disease.
Yes.
That is one of the ways. The other way is, okay, much as you love someone, you've taken long without seeing this person, the moment you meet again, let us avoid these immediate emotional hugs. Because you may hug someone who is already sweating. And then in the process of hugging this person, the sweat gets into contact with your
You
body.
don't even know where this person is
Is
coming
coming from.
from because
Definitely.
the disease is already in the country.
Yes.
Yeah.
So I think we should also avoid those hugs. Like in general, we should avoid contact with people's body fluids for now, until they tell us that the disease is what mitigated and we are now good to go. For now, let us avoid contact with body fluids. Now, the other way we can avoid the disease is most importantly is following the procedures and the guidelines put in place by the Ministry of Health.
Yes.
Because these procedures, they may sometimes they feel so much harsh, they may feel so inconveniencing. Because imagine people are supposed to be celebrating their matters,
Yes.
and then they failed to go to Namgongo. Namgongo is always filled with people every year in,
Always
year out.
packed.
And people are making business from that day. People
Yes.
come and make money.
A lot of
So
people are
imagine you had your
crying.
calculations for that day, you had to go and make money, and then
So unfortunate.
people were not allowed to
Some
come.
people ship goods to make sure that by this time
And
the
they do
goods
it
will
prior.
be with them. Yes.
So just imagine you shipped your things from wherever you shipped them, and then on reaching, the day has been
And by the way, it was on a short
Cancelled.
notice.
yes.
Yes.
So we should understand that these guidelines are not here to bring us suffering, but they are here to help us maintain our life, and then we stay
Yes.
healthy as a country.
Yeah.
Because again, it would be worse if the disease is spread too much and then we go into a lockdown.
Yes,
That
that's
would
true.
again worsen things. So we should respect the guidelines put in place by the Ministry of Health, and also we should report cases immediately. The moment I see that in you are behaving in the way I don't
Yes.
understand, it is just a call away. I just pick my phone, dial 0800 100 and then 066.
I think that helps in following up the chain. And,
Yes.
By the way,
that is a
Dr. Alfred,
sensitive
you
thing.
should re-echo that number because
It
some
is.
people wonder who they should call.
It is a toll-free number, and it is on every banner, every information poster that is given out by the Ministry of Health. It is
Yes.
there. So you just have to dial 0800 100 066.
Repeat it
And
again.
0800 100 066.
So
It is a
friends,
toll-free
let's
number.
not keep quiet. The number is toll free. The moment you see someone with any signs, even if you do not get consent, because this is for the good of the whole community.
No.
Someone might say, "Ani goitira abo
With,
wendwalirayo."
with Ebola, there is no consent. The moment you suspect someone,
Yes.
that's why
Don't
it's
even
an
tell
alert
them.
number. That's why it's an alert number.
Yes.
Because a number ya Lugambo, in fact, that's how I should put it. Yakola Lugambo. So if you're going to make
bakubire
Lugambo on someone,
obagambe wano
you
nyinawo
don't
gwe
have to inform them.
sitategeera.
Yes.
Eh.
Tomutegeeza, you don't have to inform someone you're going to report. Ngenda kuloopa.
Yes.
That's not how it works.
Si byakuteesaako.
Yes, so let us just be vigilant.
You cannot have someone in the house, someone is shivering, you test malaria, it is negative, and then you keep quiet with such a person. Call the rescue team because you're doing a favor to them.
Even if
Ebola
it-
is treatable.
Even if it is your father, you're helping your father. Mate. Even if
Yes.
it is your lovely boyfriend, lovely girlfriend, the one that you
Yes.
don't want to let go, the one
Yeah.
that you want to keep around yourself all the time,
Yes.
please report that person. Then the other way you can prevent that disease, just in case, God forbid, it happens and then someone dies of Ebola,
Yes.
we should follow the guidelines for burial. Because we've already seen, if you get into contact with a diseased person, you're also going to contact the disease, especially if it is the body fluids. Now, when someone dies from Ebola, it doesn't necessarily mean that the virus is also dead with the person. It remains in the body alive.
Yes.
So the moment you get into contact with their body fluid, you're going to contact the disease, and then you also start suffering. So in case someone dies of Ebola, much as he is your loved one, much as you want to bury that person yourself, please call the Ministry of Health. They will send you a team, a specialized team that is trained for burial in case of these cases. And then
And by the way, this thing is so true. You know, people, if you haven't seen it happen in your community, you might think it is a joke. If you hear it in Bundibujo, and we had it recently in Kampala Hospital, the cases they got from there, all the cases that they've got so far, they are here in Kampala, which means it is moving and it is true. So we should adhere to the standard operating procedures that have been put place by the government. These procedures, of course, have been tested and proved to be working. If they tell you that before you enter this building, you have to sanitize. And by that, I'm so happy that some people are doing it at their homes. I was coming from home, then I realized that at the gate, they've put their water for us with soap and then sanitizer. You to get in and children to start welcoming you from wherever you're coming from, you need to sanitize and you need to make sure that you've washed your hands thoroughly with soap, which means the soap that they told us to use, the sanitizer that they encourage us to use, has been tested and proved to be working, and that is by killing the virus. So we can adhere to that to stay safe. So, doctor, because Alfred has talked about the people at risk,
Yes.
we've not talked about the medical practitioners in the hospital, because the moment they get a case, they bring them to the hospital. So which guidance and advice, because we want to talk to different people in different capacities. We've talked to the family members, community members, what they should do in case they get a case for Ebola. Which advice would you give to your fellow medical practitioners in the hospitals? Because as for me, I might even fear to go to the hospital. How do you tell me that I should go in a ward with someone with Ebola? And which, because I've even started thinking that, are these people even paid extra money to manage? Because this is so deadly.
Such a risky job.
How would you tell me to come and work on someone with Ebola?
Thank you. First of all,
And maybe you should paint for us a picture of how, because we want to know how you ensure that you're safe before working on someone with Ebola. Yeah, paint for us a picture of someone going to manage that.
okay, thank you.
Okay.
First of all, the tone you used really reflects what's happening in the society. First of all, Ebola, as in the explanations previously,
Yes.
it's not an airborne disease.
Yes.
Meaning you have to collect it, put it in the soft parts.
Yes.
You have to pick it, put it in your soft parts. For example, the eyes, the mouth,
Yeah.
and all that. You've talked of the preventions. Well, we are lucky that these viruses, once they are out, we can kill them. And most of all the sanitizers that are on market, I'm sure they have 70% and above alcohol. And trust me, the virus can't survive. So one, the message to the health practitioners, because this is very important, most of them were contracting, most of them. All those ones who tried to attend to the first case happen to get.
Oh my
It's
God.
very
You see
alarming.
now?
Yes, they happen to get, So one, we have to follow the PPEs. You have to really have those protective gears.
Yes.
Personal protective
Yes,
equipment.
and you have to really do the covering of yourself. And then before you encroach any patient, because we have cases that you won't know. I liked the index those people presented when they saw someone who was vomiting. Ebola, you won't know that it is Ebola. So that suspicion index should be high. Actually, I encourage all those medical practitioners to have that high suspicion index. The early signs and symptoms are typical signs of malaria, typical signs of typhoid, totally typical signs of even a bacterial infection.
Yes.
I mean, joint pain, that's malaria. Actually, if you come to me and it's joint pain and fever, I'll clinically treat malaria. You get it? So, and these are the signs that are early in what? In this Ebola case. And one thing you should know, as they have talked of contact tracing, isolation, and all that, as we are all running for that, I encourage the medical practitioners to have a very high suspicion index.
Yeah.
Very high. I know they know the rest because trust me, they protect themselves. They are very, of course, surveillance teams and all that. We are having those protection gears, but then now we need that high suspicion index. We should learn from those people in Kampala. Yes, it's okay if the guy was hungry, but then it was not Ebola. What if it was Ebola? So that's what I encourage them for, and also to really try to put on the PPEs. They're really very important. Don't take anything for granted.
Even if you work at the reception.
Exactly. Then we have the technique of contact tracing. Right now we are surviving more on history taking than even the tests that are being done.
Yes.
You're going to see that right now, for you to confirm Ebola, if it's not the Uganda virus Research Institute in Entebbe, Of course, there are some, they have decentralized it. We have some in Mbarara, Referral, Arua.
Yes.
But then still those places are far. What of this medical practitioner who is deep? You get it? So history is very important. Ask the patient, where are you from? So if you see someone who's coming from Bundibujo, like the Western Uganda, run suspicious.
Yes. Have you been traveling
exactly?
the past
So
days? Yeah.
that is what the message I send for them. Let them have that suspicion high, mostly at the moment.
Yeah.
And trust me, it will be done. Otherwise, it's happening, and we have to face it.
Yes.
And you talked of the fear. We have treated this before. Now you're forgetting the scenarios of COVID. Now COVID, for it, you could just do it. You get it? And I won't say that they're giving a lot of money because we are really having some struggles even in medical. A lot of that are going on, but once you come into medical, you're here to serve. Actually, once you start doing the medical work,
No, these people should
you're here
start
to serve
paying
the
us the
empathy.
interns. Because why would you tell me to start working on cases of Ebola? You want me to die even before I go into the field?
of course, now that's a long story. And
Yes,
the
I want
struggles
to
that
take this opportunity
Okay.
to call upon the Ministry of Health, Dr. Balio Munsi. We've just put him in office. They should
Exactly.
work on us as medical
It's
interns.
just a doctor.
We work at risk now. Yes.
That's very true.
Yes.
But then putting that aside, we're here to serve. As we are all having these struggles, we have to save life. It feels good saving life.
Yes.
And with Ebola, you can get recovered. I didn't say we have a cure yet, but you can get recovered.
Yes.
We have to, as the statistics that are fine.
Yeah.
Yeah, maybe as to emphasize on something before we forget, they talked of sperm, Ebola having long life in sperm as a preventive measure. Even the discharged people, please take more 6 months without having the sex.
Hey.
Yes, we assume that once the ministry releases you,
Are
yes,
you not telling someone to
exactly.
die?
That is very important.
Now, let me
On behalf of the viewers, yes, Fred, if I may ask,
Refuse to be
that's
judged.
the question why I leave the question.
you can ask because the public needs to know.
6 months.
Yes,
Okay. Let us take the 6 months. Please.
Can go without.
yes, 6 months, or you abstain either, or you condom use. And this is proven, by the way. We assume that once you're released, you're fine. Actually, someone who has recovered from the virus is fine. They don't spread. Apart from that one part. This virus has some long time in the sperms.
Because I was going to talk about the sweating. That's
No,
how
even if
it is.
once you're released, you're fine. You're recovered, but then we only have that one part. I think
Why you raise that part?
God
Why
has
you raise
reasons.
that part?
God has reasons.
Oh my
But still, you can use condom
Yes.
for 6 months. Then after 6 months, we, of course, now
How
you
do you
can.
even touch me if you were a case for Ebola and you covered? Am I not even going to run? You will not.
Where are you running to?
That is a stigma you have to
Where are
clear
you
to
running
the
to?
public.
Where are you running to?
I think
That
Musau-
one I can assure you.
And when
I
you-
will leave you for some good years.
Yes.
Hey,
And then when you take
But
it, you
Musau, the
complain.
doctor has already clarified that.
Yes.
That stigmatization, you need to try and debunk it from your back.
that
Your
these
brain.
people are okay.
They are
totally-
okay.
We can't
Yes,
release
you have-
someone
you have
so
to
that
believe
we're
that
already
they're okay.
fighting, and we can't release them when they
Okay.
are to spread more.
Yes, you can't discharge. when
I don't know why
someone
whenever
you
it
have
comes to it, because
issues.
people have a lot of
Anyway,
that is life.
That's like
That's life.
Yes, by the way, we should adhere because someone might think maybe this is a hospital setting and someone at the reception, someone in the pharmacy might think that, hey, I'm not part of the team that manages Ebola and might think that they are safe. But remember, you're the first person who is going to receive someone who is a case of Ebola, which means you should be vigilant as much as someone who goes into a ward with people of Ebola. Yeah, so we should take so much care on that. So Alfat, I want you to emphasize more because we've seen that they've closed the border of DRC and Uganda totally. Because I was going to ask that these people, these drivers of trailers, you see, they are affected in most diseases because they travel from Uganda to other countries, which means it is so much possible for someone to go to DRC and come to Uganda with the virus. So I want you to emphasize more about things the government has put in place, the quarantine, everything that the government is doing so far to make sure that we combat the virus.
Now, like you've just said, the government has put in place border shutdowns.
Yes. Yeah.
Which I think are okay, but personally, I wouldn't.
Advocate for it?
Yes, I wouldn't advocate for border shutdowns because you see, when you shut down the border, you're stopping people from using the direct route through the border. They are not going to go through the border itself, but again, they are going to go via other routes.
Yeah.
And they are going to enter the country unnoticed.
That is true.
So it is better a person goes through the border, you put in place teams to check these people before they can cross the border. Because now we think that would be a better approach. People at the border, they are testing people before they cross into the country. But the moment people realize that at the border there is a lot of restrictions and they are not going to cross, definitely they are going to find other routes
As a part
to
of
enter the country.
But
And
what
that is
I-
going to further spread the disease. So anyway, I'm not a government official, so I'm not supposed to.
Of course,
man,
a
I'm
total,
not-
shut,
measures,
a total
what?
shutdown doesn't mean that they're not allowing people to come in. We have important things that
Yes,
have
there are
come into the
special
country.
cases.
Special cases are there.
Yeah.
But then still, that strictness, of course, as you've said, forces people to go.
That is
Other routes.
and that is a problem.
Because I heard that there are special cases like cargoes that are transporting food stuff. They are allowing them to go through. Maybe
Through the border.
cases, through the border. Cases of Ebola. Maybe they are suspecting those ones are going through. They are special cases.
Yes, there is this information from the East African community. They were holding talks about the Ebola outbreak in DRC and Uganda. Normally, I saw some news from Al Jazeera, they combined the cases of Uganda and those of Congo, making it to look so
Weird and
yes, because
worse.
we wonder why you would not bring news for Uganda. The cases of Uganda should be of Uganda.
Exactly.
Yes, not
That's where we are here. to
combining the
fact-check.
two countries.
That is true.
Uganda is not in Congo and Congo is not in Uganda. But this is what the East African community had to say about Ebola. They say that the confirmation of cross-border transmission of the virus in the DRC and Uganda is a stark reminder that disease surveillance is only as strong as the weakest point along a shared border. Alan Kasuja, a Uganda government spokesperson, told Reuters that the government was trying to protect its citizens, adding that it was not unexpected that some people might try to bypass official border crossings, which means people are actually crossing the
Isn't that what
border.
I've been talking about?
Yes.
You're going to be surprised that these 6 cases, the recent cases as of second,
Yes.
those small 6 cases that we've gotten, they are not Ugandans.
Yes.
Where are they from?
Interesting.
Where are they from? You want to tell me they have been within the country?
So you want to tell me they cross their border?
Obviously, it is happening because you can't tell me that they have been within the country. So what happens? The pressure that is in Congo is high. And if you look at the statistics, Congo is really not doing well when it comes to treatment and all that.
Yes.
I'm sure they have 5 recoveries as of now.
But now,
Do you know how many? Yes. Do you know how many deaths?
but
They
now
have.
we don't expect Congo to be doing well amidst their challenges.
That's true.
Because
You don't expect.
yes,
So that-
amidst their challenges, because economically and security wise, these people are
It's
unstable,
really a big
carrying-
challenge
they have
because
issues.
I saw of something also that community members are also going ahead and attack some of these reserved areas that are used for quarantine, for treating. They are going there, demolishing it. beating
Yes.
up even
By the way,
people
it is
personally,
dangerous
which I
because
see it's not a good thing, really.
yes, because this is what the UN had to advise on that crossing of the border between DRC and Uganda. It is saying that for migration, the UN International Organization for Migration, meanwhile, warned that border closures between Uganda and the DRC may push people towards less monitored informational crossing points, increasing the risk of further spread of the Bundibujo Ebola
That is
virus.
exactly my
Which
point.
means people should be allowed before. It's like using maybe the main
Like-
entrance of the school is here. You come through the gate, they give you sanitizer, they monitor your temperature, they want you to wash your hands. But if they don't do that, if they close the main gate and you want to get into school, which means you're going to jump the fence. If you jump the fence, automatically you're going to get into contact with other people's, and maybe you have the virus. So
For
that
me,
is what
my take they should at least set up a quarantine area at the border. Allow people to come through. They are quarantined for some number of days at the border. Then they're allowed to go whenever they are tested negative.
Because interestingly,
Otherwise-
there are even locked markets. I don't remember these are things that the people of that community survive on.
Of course,
This
it's going
is
to affect
where
the economy.
they go and make money for food. And
So maybe the challenge is with the international laws, because if someone comes in and they are discovered within Uganda, it is your case. Right now we're counting 15 cases plus the 6 people who were discovered. So if you allow them come in, you're going to get a burden.
But now
So
the
it is all
problem is-
you guys
Yes.
very tactical.
I understand.
It's a technique that
Technical,
you're going to allow them in. Once you find out that this one is sick,
that is your case.
that is your case.
I understand now, but
Yeah.
still, these people, the moment they cross without you not seeing them,
it is
they are going
it is
to
a
further
very
spread
big
that
challenge,
disease
that
to
is
your community, and then you're going to have a bigger burden, because it is easier to manage 2 people that cross the border than managing hundreds of people that
don't
have
know.
contracted the disease from these 2 people.
Yes.
Would you find it challenging?
So, doctor, at this very point, because some of us are medical interns, I wanted us to use this chance, since we have you who has gone through all that, and our Minister of Health is was also a medical intern at some point.
That is very true.
Yeah. Last night on X, Kanari Mugume had a conversation with Dr. Asimwe, and they were talking about the payment, because as we talk of now, Dr. Diana Atwine,
The permanent secretary.
yes, the permanent secretary, together with Janet Kataha, they signed a document that was to restrict the medical interns from getting their payments, the allowances as medical interns. And that issue of adding a year to the 5 years we had already. Before graduating, you have to go a further year during internship for you to get that transcript and for you to celebrate all that. And people have been saying, if you follow the conversations of X, that this is putting a risk on the patients. That the patients should be more worried than us who are getting the payments, because medical interns do 70% of the work in hospitals, and that is true. That is true. If you have gone to hospitals, you will see that the doctor comes in to supervise what you've done at the wards. And now just take a picture of a medical intern who has not been given rent, which means they are looking for rent.
That's true.
Who has not been given upkeep to help him or her through the day, who has not been given food. People are saying, how is that person? So have you people seen the trending picture on social media where a medical intern is taking normal saline to save a life?
there are all sorts
Oh
of
my
information
God.
on social
And it is
Yeah.
alarming at this moment,
Yes.
because we are just remaining with a month. It is going to be implemented with the intake of July. It's when that policy is going to start working. So people are worried. If you go all over all social media platforms, people are saying, how are medical interns going to do it? How are these hungry doctors going to work on us? So, doctor, what do you have to say about that? Because it's actually going to work. Because it was signed, we have been seeing allowances for medical interns being reduced. The time Dr. Balyomunsi did his placement, the allowances they had have been reducing, and right now they are abolished. What do you have to say about that? Is it true that the patients should worry more and should put more pressure? Because people are saying that, how is it that the government administrators are increasing, the ministers are increasing, sectors where money have been put are increasing, which is not a problem, but prioritizing those things that are critical in the country. What do you have to say about that policy that adds us a year and abolishes the allowances?
First of all, personally,
Yes.
you say it's going to start. It's starting, but it's not going to work. Working and starting are different. You know, these people are doing 70% of the work. Trust me, all those people have been at the hospital.
Yeah.
These consultants and these other people who come in are not doing the work. And second of all, it's very embarrassing. It's it's a federated country. If you really try to go generally, look at the sums of money an MP is getting. Look at the sums of money, the number of ministers who are increasing, and they all have to be accommodated for. And these are the people who are running the country. The country is being run by arts people. They have not yet seen the importance that is in sciences. But I want to tell you that only what is happening right now, the Ebola and all that, shows the necessity of the medical section. You get it? And so they have just pushed the burden to the patients.
Yes.
They're going to exploit the patients. I mean, how am I going to survive? I've been placed in Chinkwang, some far hospital.
And by then they place
That is it, because it has to be all over the country. Yes, and how am I going to survive? So I'm going to exploit the patient. You get it? And of course, they're doing this. They may not feel the pressure because they go to those expensive hospitals and they're treated abroad and all that. So they are killing the health sector in Uganda simply because they know what is going to happen to them. In case they get sick, they'll go to South Africa. They'll go to Kenya. They'll go, imagine Kenya. They'll go to Kenya. So that shows that they are having no hope for the medical section. But I strongly stand against that. And to my observation, the president for the medical association is really doing a great work. He's mobilizing the people. And I call upon all maybe other, whatever cadre you are, this concerns you. Because whatever cadre you are, this concerns you, because whom are you going to work with? You're going to work with an hungry intern. Hungry and angry at the same time.
Hungry.
Everything is bad. hungry, because I'm not going to be fine. So I strongly stand against that. And I think it is all about the budget. People who are making those policies, they're making the president make a mistake. These policy makers. And because they are through it already, they feel like it's not their concern.
And by the way, there is a document that the medical association has been using to back up what they're saying, because the president signed a certain document, I think in 2023, where he was telling he was increasing the allowances for the medical interns, and it worked for some time. For those people who received the allowances, it was really working. And he has not yet stopped that. So people are asking, how is it that he signed that we should be given this amount? He hasn't said that let them retrieve the allowances we are giving them, but a document has been signed. In fact, if you followed the conversation that Dr. Simo had with Canary, he's saying, because Canary had invited any individual who can talk on behalf of the Ministry of Health about what they did, but no one showed up. They didn't have anyone to speak for them about how they came to that conclusion. They didn't consult any association, not the nurses or midwives, not the surgeons, not the dental surgeons. No one was consulted for that to be put in place. So we strongly stand against that, and we advocate for the payment of the medical interns at the wards. So we are getting back to our conversation, if you do not mind.
It is okay.
Yes. So we want to address the myth about Ebola. Is there any myth you've heard about regarding Ebola virus? Because people do not understand it, which means they have a lot of false information going on.
Myth about Ebola. Before that, there is a question I wanted the doctor to address.
It's okay, you can pass it on.
We did not talk about. You know, people say dog's meat is sweet, But say
Hey.
the monkeys are sweet.
Oh my
So we hear that this Ebola disease is gotten from. They call them fruit monkeys, or so. How does it come about? Is it really true, or does this Ebola virus also affect these animals also where it affects us?
First of all, Congo is having a lot of those episodes because those people don't settle. I mean, they're always eating chimpanzees, they're eating monkeys. You know, that big forest they have. But then these animals work as a good reservoirs for these viruses. Good reservoirs, actually. If you to take a good follow up, you can find that it initially started from there. Actually, most of the viruses, even if you go so deep about HIV, you're going to see some theories. You get it? That take us there. So these animals take a good, they work as good reservoirs, even bats. Now, there's a very serious bat. Is it called a fruit bat? That is so much in Congo. You get these bats, and these people are eating them. Yes, so and these animals have, I would say, a good immunity that they will live with it.
Yes.
They will live with it. You won't know you
Normally
eat
and
it.
comfortably.
Yes, and you shall do what? You shall take it in. So I think health awareness has to be done more so on what to eat, what not to eat. You get it? Because these animals really reserve these animals so well. But I don't think there's nothing bats that don't have.
So among the preventive measures, we should also include making sure that if you to eat meat,
Eat what is
wild meat.
exactly. Let's try to ignore wild animals.
And
What do you want?
That's
That's why you not even but
makes sense out of.
let's eat what we have to eat. Let's eat what we have to eat.
I don't want to comment on people's preferences, but it's
Let's
weird.
eat what we are supposed to eat.
Exactly.
It's really weird. By the way, David, before we continue, I would like to inform our viewers that we are in an era where construction in this country has become a problem. Before you can put up a building, you need to get permission from the government.
Yes.
And then before you can also start using your constructed house on your own money, you also have to get permission from the government. So it would be weird if you construct your house and then a person from the government comes and tells you, this is not over the quality we need. So please do not use this house. So that's why I'm coming to advise people that we have a hardware in Banda. It is called Califan hardware. So instead of going somewhere else and you get a cheap but poor quality products, please visit these people. They are found in Banda opposite.
Yeah.
I've forgotten the opposite, but it is in Banda. It's called Califan hardware, and then they do deliveries as well.
Okay.
So please visit them. I think an advert is going to be passing through as we continue. So
all
please copy
genuine equipments you can want. Yeah. All right.
Okay, Musao, know some of the myth we have in the society. They say Ebola is witchcraft. They say Ebola is curse. Address some of them. Please help us.
How is it that out of the 1,000 people, 1,000 million people we have in Uganda, you're the only one contracting Ebola?
Yes.
Yes. First of all, Ebola is not a curse. Ebola is not witchcraft. It's a disease caused by Ebola virus, and it's once you report it early, you recover. So I think they call it a curse because of the way these people present. You know, if you see someone it's weird seeing someone having the blood from the eyes. You know, actually, most of the hemorrhagic cases. The first time I saw a hemorrhagic case, I was also scared. I think I was a student. That was around in Nakaseke. Actually, it wasn't Ebola, but it was a hemorrhagic case.
Yes.
You get it? So, but if you look at the patient, you can sincerely say, no, this is not normal. Yeah, so that fear is the one that makes them feel like it's a curse or someone has been cursed. And because it's not common. Actually, if you get an Ebola case, it's an outbreak, even if it's one. Even if we get one person, it's an outbreak. So it's not common. In 2011, we only got that outbreak. It was one patient who died. If you go into the statistics, they won't tell you it was one case, one day. And it was an outbreak. 2011, yes.
I think that is why people
Yes. So yeah. So because it's not common, And because once it's out, it's an alarm. If you get malaria, who's going to make it an alarm? Show me a record that shows that some people in whatever got malaria. But we have that one record of someone in 2011 who got Ebola and died. It is there. So that makes it a bit special, but then it's not a curse. And that's a very wrong thing because we have seen people recovering. Our 2 people are doing fine.
Ebola is not death.
Yes.
Sentence.
And Ebola is not death sentence. Report early. Report early because the early you do, what we do is support the body. And if you support the body, you become
you boost the immunity and then it will fight for itself.
Yes. Yes. So let's report early for quick recovery.
Yes.
Okay. Thank you.
So, Doctor, before we came on set, I had questions that people were asking about because, you know, you're trending on social media. People have many questions. And I think so far we've answered a bit many of them. Because the first one was, can Ebola be cured, which you've just talked about?
Ebola, you can recover.
You can re-echo on anything if you would like to.
I want to be clear about that. There's no cure for Ebola, but you can recover. Actually, there's no cure for any viral infection. I think now that makes sense. Flu is a viral infection, but you can recover from flu with support. With
supporting the immunity and then managing the symptoms.
That is true. Okay. So if you report someone early, they are going to recover fully and they're going to be very fine.
Okay.
Yes, and that's what the ministry is doing. Ministry of Health we call it symptomatic treatment and support. We support your immune system because it can fight for itself. Yes.
Okay, and another question was, how long does it take for symptoms to appear? I think
Fred answered that. He talked about an incubation period. And
Albert answered who is most at risk. Maybe if you have another class of people that is at risk, because we've really exhausted them. And can survivors spread the disease?
I think that was
You want to take us back?
Survivors.
You want us to go back into 6 months?
Survivors don't spread. Yes.
Okay, which means
you cannot spread.
You even have the disease that you want to spread because you're discharged.
The disease is still in your semen.
But in semen, don't do protected sex. Use condoms. For 6 months.
No, you can go the 6 months without sex.
It is something very simple. But condom use is not bad.
Why couldn't you?
Condom use because this is a virus.
6 months.
So
That is
use,
appropriate,
it's okay.
Why don't they leave those people in those centers where they put them for Ebola before they bring them to the community for those 6 months? Such that we know by the time it's out.
You know, by the time we release you, you're fine. Actually, by the time by the time they release you, tests are negative.
Definitely, much.
But we put that measure. Of course, I can't go deep. The reasons that's why they come up with that. But there's that measure, and there is a specific people you see that they are not even spreading. But then we are grouping all of you to do the same thing. We don't want this to happen to anyone. So prevent. By the time we release you, give yourself a reserve of 6 months. Use condoms. We have not told you not to do sex. Yes, we are telling them to use condoms.
Just don't do sex. Protect your loved one.
But by the virtue of being human, I still think people are going to stigmatize you. Even if you're completely
of course, now stigma is there.
By virtue of being humane, actually. But then, we should encourage the public, please. These people, the moment you've recovered, they are free from Ebola. They are free. They are no more people again.
But you see, if someone is still stigmatizing someone because they have recovered from Ebola in this era where information is free of charge,
that's true.
Because we are also here seated giving people free information.
We are unmasking everything.
I just don't get your understanding. Yes. Because you have all the information you need to know what is right and what is not right.
So our dear viewers, thank you for following us even up to this moment. For those, if you find this interesting, you can please subscribe to our YouTube channel such that every time we drop a new video, you get a notification that this is from Health Unmasked. This information is so much of importance to your life. You need to be equipped in order to make such simple decisions. Now, like calling the rescue team, you need to know that in case I see this one, maybe I suspect them to be having Ebola. You need to know that these are the right people to call. So that is the reason that's why you should subscribe to our YouTube channel. And you can even follow us on TikTok, Health Unmasked as well.
Twitter.
Yeah, Twitter. Our Twitter page is also there. You can follow us. Yeah, Doctor, thank you for being with us today. Thank you for sharing the knowledge. Alpha, do you have any takeaway point you have for our dear viewers today?
The takeaway point is maybe two. First of all, I want to echo alert people. Like you should alert the Ministry of Health whenever you see any. Anyway, whenever you become suspicious of anyone. For as long as you think this person has Ebola, please alert. Then the other takeaway point is let us support Khalifan Hardware in Banda. Let us support Khalifan Hardware in Banda, and like it's not because of shares, but these people are serving genuine material for construction, and they are also giving free deliveries. Just call those numbers on the screen and support them.
Free delivery.
Yes, free deliveries.
What if I'm building my house in Masaka and I need
For as long as you support us, the delivery is going to be offered.
Okay.
Just come through, we talk. Yes.
Fred, what do you have to say before we end?
My final one to the public is, number one, Ebola is not a death sentence.
Yeah.
Does not mean that if you've gotten Ebola, doesn't mean that everything has ended. You can be given what they call, our doctor said, supportive treatment, and you'll get cured. Then lastly, this should be a collective fight. We should not say that it's only for medical personnel, it's also for the community members. You know, usually I say that the doctor is going to give you a prescription, but if you don't religiously follow what the doctor has told you, you're not going to get cured or get ill from that disease. So let's follow whatever the medical personnel are telling us, and we shall win this battle. And again, go back to our kuchakala. As Uganda, you know, we go back to our enjoyment. Thank you.
All right. So my takeaway should be that people, you should not hide sick relatives. Because you might have someone who has typical signs and symptoms of Ebola, but just because she's your mother, she's your auntie, you don't want her to be taken by the rescue team. Please report any cases you see at home, even if they are your close relatives. So, Doctor, what do you have to say as we conclude? This should be your last remark.
First of all, as I conclude, I would like to thank each and everyone who's here.
Okay.
You've really done that. If you to go the social media, I think you'll see that there are very few awareness that have been done in this format. Yeah, so I would like to thank you for that. The other thing I want to tell the public is the take home, you eat Ebola. You're going to eat Ebola for you to get it. How? You're going to pick it, put it in your mouth. You're going to pick it, put it in the eyes. Even if you get that Ebola spillage at the skin, there's no cut, you won't get it. Yeah, so meaning that we have a chance of finding ways of preventing it. Wash your hands thoroughly. Actually, the biggest tactic is washing your hands thoroughly. When you go back home, bathe with soap. You take it, bathe with soap, take it that now you're fresh for that day.
Is Fred going to be able to mitigate the spread of Ebola?
Yeah, so if you bathe,
is one of the
so if you bathe, you're going, in case you got a spillage of any virus anywhere, it's going to be killed.
My man is
We are blessed that this virus can be killed when it's outside. So that's my take home. Thorough washing of hands, because it's very cheap, soap and water. Then also, mothers, lastly, mothers, if you see, if you follow the statistics, mostly in Congo, mothers are dying 60%. Women are the ones who are dying mostly. So we take it that these are people at home. So in case your child has fallen sick, please, if you suspect it being Ebola, leave them for the health practitioners. They know how they're going to handle them. They're going to save the life, and they're going to give it back to you when they are safe. Yes, otherwise,
sometimes that's difficult for the mother. You know,
Yeah,
the
I
love
know.
that mothers have for their
that
kids.
is true, but there is-
Emotional control is very difficult.
Doctor,
Thank you,
thank
Musal.
you so much for being with us today. Thank you so much for honoring our invite. We know that you might have so many things on your schedule to do, but thank you for honoring our invite to be here to share information, because we've done this such that the public can benefit. We want to share the knowledge. We want the same knowledge that we've shared here. You can also pass it on. You can share the video to your loved ones such that they can know exactly what Ebola is. So thank you for following us even up to now. We've come to the end. Until we meet again, stay safe, stay informed. We remain health unmasked. Bye-bye.